Hello and welcome to the Eating Disorder Therapist podcast. This is a podcast to help you find peace with food and overcome disordered eating. And I'm Harriet Frew, aka the Eating Disorder Therapist. And I'm so excited to share with you all kinds of stories, tips, information and guest interviews to help you on your journey in finding peace with food. So thank you so much for listening today. Now today it's me and I'm going to be talking about body dysmorphic disorder, BDD. But before I launch into this, you may have noticed that this week there's only been one podcast episode rather than two. So I just want to kind of give you a little update. I have decided that I'm going to go back to weekly episodes rather than twice a week for the time being. I've just decided I want to kind of free up a little bit more time for myself, in the spirit of self-care, looking after myself, all those good things. And I may at some point return to doing bi-weekly, twice weekly episodes, but for now it's going to be back to the one episode. And this will be a mixture of guest interviews and also solo episodes. You'll still be getting all that great content. And thank you so much for listening and supporting me in this whole process. Massively, massively appreciate you all. So before we launch in today, short advertisement break. On the outside, you have it all together, you're successful, you seem happy, but what your friends and family don't see is that you're living in the vicious cycle of bulimia, and you know that something needs to change, your health depends on it, but you just don't know where to start or how to move forward. And that's where Conquering Bulimia comes in. It's a one-of-a-kind online recovery course brought to you by certified eating disorder coaches Sarah Lee and Merit Elizabeth. They know exactly what you're going through. They both recovered from bulimia and have teamed up with leading experts to create an online course with over 70 videos as a powerful addition to your recovery. Conquering Bulimia is private and self-paced, filled with personal stories and coaching tips that will teach you how to change your behaviours for good. It will challenge and inspire you, and it's affordable, offered at an incredible discount of over 60% of the cost of one-on-one coaching. Break free from bulimia on your terms and start living the life of peace you deserve at conqueringbulimia.com. Link is in the show notes. So today I'm going to be talking about body dysmorphic disorder. This is something I don't think I've ever talked about on the podcast before. I do believe we've had a couple of guests that have talked about it briefly. Elle Mace, I think, was one. So search for that episode if you want to explore a bit more. So body dysmorphic disorder is an anxiety disorder. So I'm going to be talking a bit more about what it is, how it shows up, how it can overlap with eating disorders, and also looking at different treatment options. So someone with body dysmorphic disorder, BDD, they have an almost obsessive preoccupation with their appearance and grossly distorted view of what they look like. Now, I think it's really important to say here, this is not about vanity at all. This is a really debilitating condition that causes a lot of distress, okay? And in reality, as an observer looking at the person with BDD, we would probably think their flaws are non-existent or really slight. We wouldn't be seeing their perceived flaws in the same way. But someone struggling with BDD sees their body in a very, very different way and have this sort of obsessive preoccupation with their appearance and very distorted view of what they look like. And this causes a lot of distress. Now, the degree of distress this causes leads to a lot of sadness, shame or anxiety and or impairment then in the day-to-day functioning. So it might mean avoidance of social situations, of going to college or school, impairment in one's job, a lot of isolation because of someone is dealing with this layer of distress every day, these very, very difficult feelings, all these intrusive thoughts. So it makes going about day-to-day life extremely challenging. So it's estimated to impact 1 in 50 people, and it often begins in adolescence. I think it's much more common than we recognise. I think very helpfully, Elizabeth Day, who has the podcast How to Fail and various books, etc. out. Elizabeth talked recently about her, I don't know if it's her husband or partner having BDD, and just talking about that very, very openly and in a very, very helpful way. So that's something you might also want to follow up if you want to sort of hear a bit more about it, because I think she is very passionate about spreading positive mental health messages, and it seems that her partner / husband has been prepared to talk openly about that very helpfully. So BDD as well, it impacts all genders. It's not just kind of one gender who will struggle with this. And what's interesting is a person with BDD may focus on any part of their body. So often the most common things that people will focus on in their body are things like facial features, such as the nose, maybe skin, things like moles, freckles, scars or acne, maybe muscle size or tone, could be size and shape of genitalia or breasts, could also be hair, including facial and body hair. And what someone will do as well is, because they're very, very focused on these perceived flaws, it will involve a lot of daily body checking, a lot of comparison of their body with others, and also trying to camouflage or mask their flaws. So that can sort of take up a lot of time. So let's think a bit more about some of the signs and symptoms of BDD, just elaborating on some of those things I've just talked about there. So if you have BDD and you have a lot of distress around this body part or body parts, you're probably repeatedly checking your reflection in the mirror, or you may be staying away from mirrors altogether, but you probably don't have the most healthy relationship with the mirror. So maybe when you're on your own, you may be checking your reflection compulsively. You might feel like you just need to keep going back for reassurance, checking again and again. And on the other hand, you might just completely avoid mirrors because seeing your reflection causes you so much distress. So I guess you haven't got that kind of more middle of the road relationship with the mirror. You tend to be one extreme or the other. Something else that you might do is you might isolate yourself so that others aren't going to see your perceived offending body part. So you might avoid work or school or college or social events or public places out of stress over others seeing you. Or you may only go out at night, or perhaps at a time when you feel you're not going to see other people. So it almost feels like you've got that kind of spotlight on you all the time, causes high levels of anxiety. Another thing you might do as well is spend a lot of energy camouflaging or covering up the perceived flaw. So you may wear sort of strategic clothing, makeup, accessories to disguise the area you're worried about. And you may also position your body in a way to minimize the flaw. So you might try to cover it with hats or scarves or baggy pants, or wear clothing perhaps inappropriate for certain weather because you are more concerned about just not wanting to draw any attention to the body part that you are feeling very anxious about. So you may also really dislike having your photograph taken. You might avoid social gatherings, and you might really police the photos others take of you and want to really make sure that your flaw isn't visible. So you'll be really, really kind of obsessed and overly checking all of these things. You may undergo plastic surgery to correct the perceived imperfection, and you may believe perhaps that plastic surgery will solve all your problems. But you might find as well that if you've already undergone a procedure, you're still not happy with the result. It doesn't kind of bring you that peace of mind that you were hoping for. You may pick your skin compulsively, which then leads to injury. So skin picking might also be a symptom of OCD, obsessive compulsive disorder. However, if it is done with the intention of improving appearance, it's more likely to be BDD. You might as well compare yourself negatively to others. This includes comparing yourself to celebrities or photos of yourself at a younger age, and you'll be focusing on how bad your flaw looks in comparison to others. You may as well put a lot of effort into changing the feature with excessive exercise or tanning. And if you suffer from BDD, you might feel unhappy with your hair, have frequent haircuts, and avoid going out after you've had one. So lots of different anxiety here. And you may overspend on personal grooming. So you may spend a significant amount of your paycheck or allowance on products and services designed to enhance your looks. But then you don't find that peace and happiness from that. You tend to quickly grow disillusioned and then search for other products or treatments to try and make you feel better. So it's like this kind of endless kind of loop, I guess, really, really hard to get off. And I guess what we're sort of saying here as well is we're not saying there's anything wrong with wanting to change your appearance or manipulate some of the ways you look, etc. But I think, as you can see, someone with BDD is very distressed by their appearance. It's creating a lot of intrusive thoughts. It's creating a lot of intense and difficult emotions, and a focus on the body has almost become obsessive and too much, and that is causing a lot of distress. So how does BDD differ from an eating disorder? So of course, with an eating disorder, someone usually does not like their body. There can be a lot of high sort of level body dissatisfaction, but this tends to be more around weight and shape. Okay, so someone might still have high levels of distress around their body, but it's slightly different from BDD. With BDD, it's much more around someone's perceived flaw and maybe a specific body part. What's interesting, though, is that almost 1/3 of individuals with BDD also have an eating disorder at some point during their lifetime. So there is some overlap there. So most people with eating disorders, as I've said, will express strong body dissatisfaction, but it's different from BDD, because to have a diagnosis of BDD, you'll be experiencing high levels of distress and preoccupation around one or more perceived appearance defects. So people with BDD do experience very high levels of distress, frequently feeling anxious, ashamed, disgusted and depressed. So I really can't overemphasize this, how distressing it is for people and how much anguish it actually causes. Now, it can lead to severe depression and anxiety, self-harming behaviour and even suicidal ideation. So figures apparently show as well that 1 in 330 people take their life every year due to BDD. So I think it's so important, isn't it, just to realise how upsetting and distressing it is to live with this. And, it's really quite torturous for people. Okay, so time for a short advertisement break. I know that we talk about strategies to overcome eating disorders and find food freedom on this podcast, and I've often shared my story to let you know that you're not alone in the struggle and that yes, you can recover from eating disorders completely. One of my friends, Dr. Marianne-Miller, has a podcast that covers similar topics. It's called Dr. Marianne-Land, an eating disorder recovery podcast. I've guested on it twice and I'm lined up for a third time in the coming weeks. Dr. Marianne also had an eating disorder for nearly 25 years. She went through atypical anorexia, exercise bulimia and binge eating disorder. And she really has a unique voice that speaks not only to people in recovery, but also to individuals in larger bodies. Listening to her podcast will help you find mental clarity and deep-rooted healing that comes from her knowledge as an eating disorder therapist and binge eating coach. Subscribe to Dr. Marianne-Land, an eating disorder recovery podcast on Apple, Spotify and other platforms. Check out the links in the show notes, including the links to one of my guest episodes. Okay, so let's talk a bit now about causes and risk factors for body dysmorphic disorder. So the exact causes of BDD are uncertain, but it's thought, as with all mental health conditions, it's a combination of genetic and environmental factors. And studies show that 8% of people with BDD have a close family member who has been diagnosed with this as well. So this suggests there may be a hereditary component that increases the chances of developing BDD. Now, I guess as well, BDD is often an unconscious way to deal with underlying distress. Now, as with an eating disorder, or with obsessive compulsive disorder, other ways of coping, usually this has become a coping strategy for maybe distancing yourself from painful emotions, maybe a way to distract yourself from other painful things that are going on in your life. Maybe it's giving you a sense of control when other areas of your life feel out of control. Maybe it's a way of temporarily kind of boosting self-esteem, feeling a little bit better about yourself when you feel that you are changing your body part, whatever, in a way that's going to be, in inverted commas, helpful. But I guess ultimately it's a kind of often unconscious sort of, way of coping with underlying distress. And I guess what's interesting, and I think this is what's fascinating about human beings, is that we can go through sort of similar kind of traumas or things that can happen. And for one person, that will be expressed through an eating disorder, someone else that may be expressed through BDD or using alcohol or depression or anxiety. We are so different in terms of how we respond to things, and there is no right or wrong way. But maybe as well, someone that could be at risk of having BDD, maybe there's that genetic element, but also as well, perhaps there has been something early in life where there has been something around appearance that has caused distress, maybe comparisons with others, maybe bullying. So what would be really important, I guess, is when you are trying to understand why you have developed BDD, just to look at your story really and your sort of timeline, and look at the different things that have happened throughout your life, different stresses, different things that may have happened in relationships, things that have really impacted how you feel about yourself, but then also how you feel about your body. And that may be something that you need to discuss in the safety of therapy, or just with someone who you can really, really trust. So research also indicates that some people with BDD have low levels of the neurotransmitter serotonin, but the link to BDD has not yet been established. Other studies suggest that visual processing in the brain may differ in people with BDD, which may contribute to how they view images or perceive distortions. Really, really interesting. Now, if someone has experienced sexual, emotional, or physical abuse during childhood, they may be prone to developing BDD. And social factors such as being teased by others about your physical appearance can have long-lasting effects. And many of us have been the target of some type of bullying during childhood and know how hurtful and harmful this can be to thoughts and feelings about ourselves. And I think again, like the culture we live in has significant impact on our perceptions of beauty and physical appearance. So there's a great deal of emphasis in our society on being attractive, isn't there? Looking a certain way. We are bombarded with images of perfect bodies on TV and magazines and all over social media. So trying to live up to these standards can create negative feelings around your worth and self-esteem, particularly as well if you have perfectionist tendencies. So it can heighten insecurities about your own attractiveness as you overestimate the attractiveness of others. And it's easy to see how this can lead to feelings of anxiety, depression, and shame if you have BDD. What's really interesting as well, just as a little bit about kind of plastic surgery, because I know as well, that more and more of my clients are kind of undergoing plastic surgery, even if it's more kind of minor procedures. And I know as well people in the kind of gastric community as well, often maybe having plastics after having gastric surgery. So again, perhaps they can be more vulnerable to kind of BDD as well, with all of that kind of stuff going on around body image. So it's thought that around 15% of people seeking plastic surgery have BDD. What's really positive is I'm getting more plastic surgeons and clinics contacting me now requesting body image training. So I think it's really helpful that that is being noted and identified, rather than just kind of opening the door to a lot of people that might be really struggling with their mental well-being. So what's interesting as well, that fewer than 10% of BDD patients will be satisfied with the results of plastic surgery, and their anxieties are often then transferred to another aspect of their appearance. So polysurgical addiction as well is a psychological condition characterised by a compulsive and excessive desire to undergo multiple cosmetic surgeries or procedures. And I think, we sometimes see this, don't we, with sort of celebrities. I can really understand as well when there's so much pressure in the limelight, a lot of stress as well. You can really see how people fall down this kind of rabbit hole. It's very understandable. So BDD is often treated with serotonin reuptake inhibitors, SRI medications, specifically often at high doses. And other medications are sometimes used in addition to an SRI. So the most effective therapy is cognitive behavioural therapy and is tailored to BDD's unique symptoms. And these treatments significantly improve BDD symptoms in most patients. So I want to say here as well that I have worked in eating disorders for all of my career. What's very, very interesting is that BDD is treated in a completely different, sort of under a different umbrella when I've worked in the NHS. So we didn't sort of see people specifically coming for help with BDD, although many of the eating disorder clients that I saw also had some BDD symptoms. So I just want to kind of just say as well, before there is a rush of people kind of contacting me to ask for therapy to work with BDD, I would say that although this is something that I have some understanding and knowing about, I'm not a specialist in this, and I wouldn't actually go and sort of work in a sort of therapeutic relationship with someone with BDD, because I think it's not my area of expertise. So just to kind of clarify that. Anyway, I hope you found this episode helpful. If you have anything more to share about BDD, do send me a DM on Instagram at the Eating Disorder Therapist, or you can email me at harriet.frew@gmail.com. Okay, so I hope you've enjoyed this episode. Thank you so much for listening. And if you're not following me already, do seek me out on Instagram at the Eating Disorder Therapist _. And for further support with your relationship with food, do go to the eatingdisordertherapist.co.uk, and I have a 10 steps to intuitive eating course and a breaking free from bulimia course that has 20% off until the end of the month. So you might want to go and have a look at that. If you enjoy this podcast, I would be so grateful if you'd follow, rate and review, as it helps it reach so many more listeners. Thank you so much for listening today, and I look forward to sharing another podcast episode with you very soon.